Okay, welcome everyone to Healthcare Crisis with a Labor Solution. This presentation today is brought to you by the Labor Table of the Healthcare as a Human Right Coalition. The folks that organized this workshop did so for the Washington State Labor Council Convention in Wenatchee in July, and it was great content. It was well received. We had really good discussion afterwards, and so repeating that content in this online space so that we have another opportunity to provide the education and also recording this so that we can use it for future educational opportunities and just to continue this really important discussion around how labor has been and needs to be involved in this fight for universal health care. My name is Carrie Wallace. I am a nurse. I use she, her pronouns. I am a dues-paying member of WSNA and National Nurses United. I'm happy to be here tonight co-presenting with Juliana. I don't know why my slides are not advancing. Sorry, guys. Love that. Okay, here's the agenda
There
for
we go.
today. We're going to have a bit of a group task. Juliana's going to lead us through a group task. She'll introduce herself as she gets started. We do have some presentation we want to bring to you. Part of that presentation includes a special message from Congresswoman Pramila Jayapal that, again, was prepared for us for that Labor Council convention. And then as we wrap up the presentation, we have another group task around, what we're going to do from here. We'll talk about some next steps and some ways that you can get involved, and then we'll stop the recording and do a Q&A so folks that don't want to be on camera can participate in that way and ask questions and whatnot. So Juliana, here we go.
Sure. Well, hey everyone. Thanks for joining tonight. Those of you that are here on the Zoom. I am a classroom teacher. I teach in Renton, and we're opening up our presentation by activating your prior knowledge and surfacing the fact that all of us are humans who, turns out, all need healthcare. We all come to this understanding of living under a very broken system based on our personal experience. So what we're going to ask you to do is, if you would be so kind as to type into the chat something about your experience with healthcare that really, for you in this moment, encapsulates how broken it is. And I'll just say a little bit out loud my experience to get maybe you thinking about your stories or a fact or a statistic or just a frustration that you have. So my mom is aging. She's 80. She has some memory issues. And I continuously, frankly, struggle with my own mental health in navigating the Medicare system, navigating Medicare Advantage specifically, in the fact that it takes a pretty much full-time job just to get the basic level of care. And she has me to help her. I'm a full-time teacher, so I need to take days off of school. It takes 3 hours to write subplans just to get her appointments figured out. And it's not that that's so terrible, but I imagine all of the elderly people or people with disabilities or people with chronic health conditions that live near me that don't have that opportunity, and they are just suffering in silence all the time. That's just one very small slice of my experience that I'm sure all of you all have many other stories or ways to describe how broken it is. So no pressure to do this if you don't want to. I taught through COVID, so you will not hurt our feelings if you don't do this, but there is something really important about activating somebody's personal experiences before we land a whole bunch of information on your plates today. So if anybody would like to type in the chat a frustration, and I would love it if you have a fact or statistic that you think is important that others should know about the healthcare system in our country or in our state or in our community. So thank you, Catherine, for getting that going over there. As people are typing, I just last night came back from Europe, and everywhere my two kids came with me. They're 21 and 23, and everywhere we went, people would talk to us about the U.S. and our current political situation, but somehow or other, healthcare always came up. People would always ask, like, how do you survive? How do you do it? Or we would always mention like, wow, you tax rate's high, but everyone has healthcare. In Europe, they are so acutely aware of how broken it is for us, perhaps more so than some Americans know. But all right, well, we are gonna, I think, move along here unless somebody wants to share theirs out loud. Catherine's got a story in the chat.
I'm happy to share, Juliana. So
Great.
this is Carrie again. I, as a nurse, have seen just hundreds and thousands of people who are really not able to do what we're asking them to do. They're not able to follow through on taking the medications that they're prescribed. They're often, signing out of the hospital against medical advice because they can't afford. They're afraid of what the bills are going to look like. And, like every story, every person has a story. And so I've been witness to thousands, but I have my own. My uncle passed away about a year ago now of colon cancer. And he had been diagnosed with cancer like 8 years prior. He'd gone through treatment. He was in remission. He was doing really well. He was working full time as a communications professor on the East Coast. And then his insurance decided they didn't want to pay for that medication anymore that was keeping his cancer at bay. And it was like $3,500 a month out of pocket, not something that him and his wife could afford. And so he stopped taking this medication. And his cancer came back. It came back into his colon. It came back in his lungs. There was a tumor on his throat. And he was dead within 6 months of this insurance decision. So just really gross. The insurance being involved in our healthcare is just really the wrong way to do healthcare, and it's just infuriating. That my family story is not unique. There's a lot of folks who decide to stop treatments and end up dying because of the decisions of the healthcare industry right
Yeah.
now.
Yeah. Yeah. Thank you for that. There are so many stories we could tell. I think there's oftentimes we feel maybe shame or like we've done something wrong if we think about our own experiences with healthcare. And we're here tonight to level up our understanding and to hopefully build the resolve of our union siblings in fighting for something that frankly it's a difficult topic if your union has fought really hard to get a decent healthcare plan relative to others. So we're gonna dive into that further. So I think we could probably go on since we've got so much information to toss everyone's way here today. Thank you for your stories in the chat. We will, if it's possible, we can capture these and add them to potentially to our slides later on. No one's names attached, of course. All right, Carrie, I think this slide's yours.
Yeah, I was going to introduce the Healthcare is a Human Right Coalition. So the HICR Labor Table, Healthcare is a Human Right, HICR for short, is a group of unionists, organizers, advocates, healthcare providers, and policy experts, folks that really are very passionate about this issue have come together underneath the Healthcare is a Human Right flag. The purpose of the labor table is to implement the intent of a resolution that we got passed at the Washington State Labor Council Convention in 2025. The whereas clauses are on the screen, they're in the slides. Really, it's around embarking on systematic education for unions and union members and to urge state and federal level policy around universal health care. Here's a few of the unions that are among those that are sponsoring or allied member organizations of the Healthcare is a Human Right Coalition, just to name a few. What guides our work at the Healthcare is a Human Right Coalition is really to achieve universal healthcare in Washington state and eventually our nation. We hope to be the Saskatchewan of the US. I think all the state-based movements say that. If folks don't know, Canada passed their national program in a single province, and Saskatchewan's not a progressive. It's a rural, conservative. It was a faith-based movement. And so we really hope to see that same kind of change here by pushing on state-based policy in the Washington State, looking at improving healthcare affordability and access, advancing health equity, and then defending access to healthcare that exists in the face of federal cuts and such. There's lots of committees that are functioning within the Healthcare as a Human Right Coalition, and this group really represents that labor table. All right, Juliana, back to you.
Sure. So this comic you may have seen in other presentations, but it really encapsulates, I think, just the inhumanity of our system. So, a doctor having to break the news to a patient that the basic things that we would consider the system is there to provide for us just doesn't exist. So being sick does not mean that you will be covered in our country. So in Washington State, we're fixing to change that. If you could go to the next slide, please, Carrie. All right, so some of the basic points that probably we don't need to reiterate with you all, but I think it is important to just underscore why we're here tonight. Even if you have a union negotiated healthcare plan, it's constantly changing. As a teacher, we're subject to the state's employee benefits, and we are finding out that more and more of our providers are just stopping being part of that system. So even though we might bargain something really great in our contract, the providers themselves, the plans themselves can change without us negotiating that. Even if you have basic care, just getting that care is hard, even with our good insurance, because of all of these, frankly, sort of secondhand trauma. The healthcare workers are often leaving their professions. And it's similar to teaching in the sense that when you are doing your best every day and seeing people suffer, you can't really do that forever. There is a point at which you need to care for yourself. And oftentimes that does mean taking a break. So we have fewer providers. That's just meaning more and more preventable deaths. And we also know that, an injury to one is an injury to all, whether somebody has a union or not. So even with our great union negotiated plans, non-union workers are at a huge disadvantage. And that, of course, not just drives the costs up economically for everyone else, but that suffering in our community affects every one of us, whether we're aware of it or not. We know that costs are rising every single year. Premiums have doubled in the last 10 years and are set to rise 22% in the next couple of months for the next coming calendar year. And when someone is out of work, as somebody said in the chat, getting COBRA or continuation of benefits is really expensive. It's complicated. If you fill out the paperwork wrong, you're just not covered. And I think another a layer to this that many of us might not think about is if you've ever been on strike or if you've been following strikes, employers often force workers into a bad TA because they threaten taking away their health care. So all of these things to say, we've been talking about the squeeze is coming, it's here. If you aren't familiar with the big, beautiful bill, many other terms for that I'm not going to say out loud. That bill from the federal government really doubled down on the healthcare inequality. We know that it gave huge tax breaks to the richest humans ever in the history of humanity while cutting healthcare for the rest of us. And as we saw during COVID, a lot of us were working on these things before COVID, but we know that the healthcare system is an exponentially difficult, I should say it's hitting underprivileged people so much harder than everybody else. Not just Medicaid recipients, but self-insured folks, people that don't have consistent employment or don't have an employer-based coverage, our retirees who work their entire lives and really do need the healthcare. The cuts are coming. The costs of, just skyrocketing costs. And at the end of the day, Washington State, we're in a good position when it comes to the political environment. A lot of our elected leaders want to do the right thing, and they've been trying, but it is not sustainable for our state government to be offsetting the atrociousness of these federal cuts. So because we're all unionists here, we felt this was important just to give a little bit of a labor perspective. The three workers you see on your screen are just examples of, and this slide, the bar graph on the left there, it does refer to the Biden plan, as we know, did not pass under Biden's tenure, but just gives you a sense for how much the costs of healthcare would be for people, for three specific union workers. So Depending on the trade, the union plan, even though it is a good plan, it is going to cost so much more than if we had a Medicare for all plan. So we'll talk in a little bit about what the difference is between Medicare for all and some of these other terms. We're talking about universal health care. But when we cover everyone, the costs are going to go down. And when there is a single payer, the bureaucratic overages is really what is nickel and diming all of us. So if you go to the next slide, Carrie, I think we're going to jump right into it here. Thank you. So as we're talking about, bargaining and union issues related to healthcare, it's important to remember that when we're at the negotiation table, we're spending time on something that really we don't need to be spending time on. When I was local president of my union, we had already transitioned to the state. But being on bargaining prior to that, we would waste hours, sometimes days and days, quibbling over small amounts of our health insurance premiums. And that was time we could have been spending on safety issues or any other workplace issue that we needed to address for our members. So when we think about bargaining for healthcare, we're still sort of dependent on our employers. We're still dependent on the insurance companies. But our wage gains are really what we're not seeing the gains in our wages as these health insurance premiums are going up. So tonight, as we talk about the solution here, really thinking through that union lens of, lowering costs means we will be able to bargain for higher wages. Currently, we are all kind of taking a pay cut when we think about how our healthcare premiums are going up. Even if our wages are going up, whether we have a cost of living adjustment or we've bargained actual raises, we are not seeing those material gains because health insurance is eating up those wins. So there are some myths out there about why we are in this situation. A lot of privatization advocates on the healthcare front tell us that doctors order too many services in a universal healthcare system, but the research says that actually isn't what's happening at all. It is the administrative cost. That is the amount of money that a doctor or any provider needs to spend on navigating bureaucratic, complex insurance and continuously sending out false bills and just swimming through the bureaucracy. Having to have full-time staffers in a small clinic means that clinic is not sustainable, but all of those costs get transferred onto us, the people, the humans, the patients. So it's not greed, no matter what they tell you. The costs are so high because private companies are raking in profits from our conditions and from this bureaucratic system. So next slide, please. We're going fast through these parts because it's darkness. So as I just said, we've got health insurance companies making record-breaking profit on our back, and we are watching around us the growing inequality, and healthcare being such a huge player in that. Just today, I was listening to NPR, and the affordability crisis. You hear it in every lane. Very often, people don't include healthcare when they're listing off all the things, whether it's rent or interest rates or gas or groceries. Healthcare is one of the biggest pieces leading to this inequality that is just off the rails. So when we're looking at Affordable Care Act and the cuts to that, we often, we want to think about what can be done at the national level. We're here tonight to really talk about what needs to be happening at the state level. So there's some changes, or excuse me, some phrases that get used interchangeably that we just wanted to give you a really brief just sort of definition, because we're talking about universal health care and most of us kind of have a vision for a possible path to get there. But you probably have heard of single payer. A single payer is really about the financing system that would allow any provider to basically have one price. And this is the difference here is that currently multiple insurance companies are competing and they are all kind of making up their own pricing system. this is inflating costs for everybody. So a single payer system means that a service has a specific cost, and it is the government or a government run agency that is setting those prices. There's also something called a public option, and this is not what we're talking about necessarily tonight, but it is something that you should be aware of. This is when there's a government sponsored plan and it competes with private insurance. So public option, I mean, we have them already in some cases. They do lower costs sometimes, but they're not a guarantee to lower the costs when you have a single payer system. Medicare for All would replace all of our private insurance, and that for some of us this is the goal, but it could, excuse me, replace private health insurance and our employee sponsored plans so that everyone is enrolled. That would be funded by some tax revenue, some public funding. And then down there in the blue, socialized medicine. Oh, is that mine or yours, Carrie? Okay. Socialized medicine is not what we're talking about in most cases, but we hear about it, and oftentimes the privatizers really want us to all be really scared of something called socialism. But socialized medicine is a government-run program. That means there would be no private providers and no private options at all, and would be fully funded through taxation. But big picture here, universal healthcare is what we're after, where everybody has access to healthcare coverage, regardless of whether it's public or private or a mix. And we're talking about universal healthcare not being attached to your employer. So it should not matter if you work at a specific kind of a job that is big enough to have an actual insurance option paid through your employer. So I hope that helps a little bit clear some of that out, because they do get used interchangeably. So I'm hopeful that Sarah is back. I know Sarah is doing some caregiving tonight. Sarah, are you here? I'm having
I
a hard.
am Juliana, and thank you so much. And thank you, Carrie. Yes, I am here. I will say I do have my mother is listening in to this conversation.
Hi,
And
Mom.
and so again, hello everyone. My name is Sarah Franklin. I am the president of OPEIU Local 8. I have been a unionist since 1988, starting out my career with ATU Local 587. And before I begin my part of the presentation, just reflecting on our conversation earlier, I remember as a young worker before I became a unionist, having to go to the country doctor and whatnot for my care before I was able to obtain health care through my employer, which was King County local government. And so I am very appreciative every day having access to healthcare and good healthcare over these number of years, but it is simply not enough because much more needs to be done where everybody is covered and has the benefit of good healthcare and a long life. So we are going to go ahead and get ready with our grounding concepts. And of course, universal healthcare is pro-labor. Single payer Medicare for All delivers four important components: freedom, equality, justice, and security. And racism is a public health crisis. And these four pillars, freedom, equality, justice, and security, are our motivation and grounding concepts of why universal health care is pro labor and why we continue to fight for that. Next slide, please. What is a single payer health care? Well, single payer national health insurance, often called Medicare for All, is a system which a federal agency, for example, Health and Human Services, organizes public financing for health care while the delivery of care remains largely in private hands. At the state level, a prominent proposed single payer plan, the Washington Health Trust, Senate Bill 5233, House Bill 1445 in 2025-2026 legislative session, would make all Washington residents eligible to receive comprehensive coverage, including vision, dental, hearing, mental health, and reproductive care, free at point of service. Next slide, please. What is single payer? Why is single payer an issue for labor? Our healthcare system provides no or inadequate care to thousands of Washingtonians, and it's getting worse. Sharing costs and including all workers are fundamental labor principles. As Juliana said, an injury to one is an injury to us all. We need to take healthcare off the bargaining table. Healthcare is a human right, not a profit making commodity. Being forced to remain in a bad job just to retain healthcare is an affront to workers' dignity. Bosses strip workers' health insurance during strikes to force bad deals on us. The Washington State Labor Council has adopted numerous resolutions calling for it. Martin Luther King said, of all the forms of inequality, injustice is in health is most shocking and inhuman because it is often results in physical death. The incalculable human cost of employer-based health care. The United States is the only developed nation, I have to emphasize that word again, only developed nation without universal health care. Mexico made a major legislative and structural push toward the true universal health care through a landmark presidential decree just this year on April the 7th, and established the Servicio Universal de Salud. This ambitious initiative legally treats medical care as a fundamental right for all 120 million citizens, removing traditional employment or income requirements. And down below, there is a link that will reflect that. From the AFL-CIO Resolution 8, we want healthy lives and a safe workplace. On June the 9th, Healthy Lives Making Healthcare a Basic Right. For more than a century, labor movement has fought to make healthcare a basic right. The gist is that everyone should have right to receive quality health care without fear of financial hardship, regardless of their race, gender, identity, or immigration status. Our goal is to move toward a single payer, like all Medicare for All, that provides universal using universal insurance model. Any such system must guarantee everyone can get health services that they need without exclusions or financial barriers to care, and with access to high quality doctors, hospitals, and care providers. This is not to diminish the hard work of union members, have won for themselves and for all working people. The Washington State Labor Council resolution, which was passed on 7/24/2025 at the last convention in July of last year, over 350 labor delegates voted in support of this resolution. And the gist of the resolution is building the Washington strategy, embark on a systemic approach to educate unions and union members regarding the fight for comprehensive universal health care. Urge state and federal legislators to implement single-payer healthcare policies such as the Washington Health Trust Bill reintroduction into the next session in January of 2027. This resolution is a good implementation, so here we are. Why are we fighting for Washington state-based single-payer system? The state-by-state patchwork quilt strategy proves proof of concept. Canada has universal health care. Only after very conservative Saskatchewan province proved it could work. And I believe this, Carrie, I want to make sure I'm not stepping into your lane. We've made huge progress in Washington and have political climate to win. All we lack is public pressure and labor support. Healthcare is a crisis with a labor solution. Senator Hasselgaw was ready, are we? And I should note that Senator Hasselgaw was a member of IBEW 174, a unionist himself. We are here to continue to build the labor foundation to move Washington forward on healthcare, justice, and affordability. This is one of our flyers from last summer, I believe, during our convention. But the Washington Health Trust Bill is a proposal for publicly funded universal health care system in Washington state. Support is growing in both chambers. During the 2025-2026 session, Senate Bill 5233 collected 9 co-sponsors, and first ever companion bill, HB 1445, was introduced by Representatives Parsley and Scott with 15 co-sponsors. We are building momentum for an improved Washington Health Trust Bill legislation in 2027, and we need your union's input.
All right, I think this is where I take it back, Sarah.
Thank you, Carrie. Thank you.
Thank you. So just to reemphasize, part of the reason we're doing all this education right now is because there's a prime opportunity for unions to provide feedback about the language in that bill, in the Washington Health Trust bill. Senator Hasegawa has been hosting stakeholders meetings relatively monthly, and the labor table for the Healthcare as a Human Right Coalition has been supporting the work of getting him the feedback that he needs so that we can build a strong coalition around this bill. A little bit of history about the Washington Health Trust bill. This is not new policy. It's not new legislation. It is based off the Washington Health Securities Trust bill that came from Healthcare for All Washington decades ago at this point. Whole Washington first introduced the Washington Health Trust in 2018 as an initiative and then as a bill in 2019. This is a universal healthcare financing plan. So much like the Medicare for All at the national level, we're not running government healthcare. We're just paying for healthcare services. It goes into a public trust, it pays directly to providers. We're essentially trying to cut the insurance companies out. It does make care free at the point of service. It's not free. We're paying for it the same way we pay for healthcare now. Again, we're just eliminating one of the middlemen in the process, the insurance companies, so that we can save some of those healthcare dollars and put them towards actual healthcare. It would be fully paid for through public financing. Providers, hospitals, the doctors and clinics that you see will remain private businesses. Whoever's employing them now will continue to employ them in the future. We do hope that the Washington Health Trust provides a little more opportunity for providers to open their own practices again, whether that's nurse practitioners or physical therapists or whoever that might be. There is at least a 4-year state transition plan. Federal programs may take longer, so this does not happen overnight. There are steps that the state needs to take. There are building blocks, existing programs within the state structures that they can use to facilitate this work. But again, it doesn't happen overnight. We are expecting a 4-year transition plan. This policy is ERISA compliant, so it's opt-in. It'll go on the exchange if we can get this bill passed, and folks can choose to participate in the Washington Health Trust or not. So Taft-Hartley plans can choose to continue to use their Taft-Hartley plan, or they can choose to use the Washington Health Trust. It's same with individuals and businesses and other unions who might not have a Taft-Hartley plan but have employer-based insurance. So they can choose to participate in this process, which I think is great. This policy has been included in the Healthcare as a Human Right policy agenda that's been voted on again by those 60 allied organizations. So included in the overall goals of the coalition. The Washington Health Trust would provide all Washington state residents with comprehensive care, medical, dental, vision, hearing, mental health care, reproductive care, medications, all the things. There would be no deductibles, no copays, no networks, things that are figments of industry. The results of insurance companies being in the middle of this. No denials for medically necessary care, no surprise bills, and zero out-of-pocket spending at the time of service. So the idea is we pay in, the money stays there until it's used for healthcare services. It's there regardless of whether we're working. It's there when we retire. It's healthcare that's always there. The legislation includes the requirements of building some boards with committee structure. The board would administer the trust, make ongoing decisions. The healthcare landscape is going to change. They're going to need to make sure that the system stays viable and financially viable and otherwise. And in order to do that, it consists of 3 advisory committees. There's the Finance Committee, a Citizens Oversight Committee, which I personally appreciate, and then a providers committee that essentially allows for collective bargaining of rates for healthcare services provided by the trust. So we talked about transparency of these rates. We talked about them being more than Medicare, Medicaid rates, but not quite as inflated as current insurance rates, but definitely something that providers have some say in so that they can keep their lights on, keep their doors open, make some money, providing the services that they provide to patients, and again, without the insurance companies kind of pillaging those systems. Washington Health Trust propose regarding Taft-Hartley plans, I mentioned it a little bit. Essentially, they can decide if they want to participate or not. And we've had some really great conversations with some of the leadership of the building trades lately, trying to think of how the Washington Health Trust could augment a Taft-Hartley plan. So there's a safety net in place for those builders and trades folks that are not working enough to qualify for insurance. And so they're stuck with those really expensive COBRA plans. This would provide a safety net to those folks. And then if the union decided to opt into using the Washington Health Trust as their core benefits plan, then they could use the dollars that they're saving for other services, for short-term disability or other kinds of leave or whatever else they would want to do. But all of that is really up to them. We're not requiring them to participate in this process. The Washington Health Trust would not restrict or impede Taft-Hartley plans. They could really decide to opt in or not. It's really of benefit to them, hopefully, and really of benefit to everyone around them. So whether they decide to keep them or not. So this is from the Labor Campaign for Single Payer. The Labor Campaign for Single Payer is a national coalition of labor folks that are fighting for single payer healthcare at the national level. They don't take a stance on state-based programs, but they do provide some commitments for labor-friendly universal healthcare at the state level. And so these are the 10 points. When we did this in Wenatchee, there's a really good one-pager we put together that kind of went line by line around how the Washington Health Trust stacks up against these 10 points. It stacks up really quite well. So we'll have to figure out a way to get a one-pager out in this digital platform. But the good news is that the Washington Health Trust really does align very well with the commitments that the Labor Campaign for Single Payer has suggested. I think our link tree is still active, and so maybe at the end of this, we'll put our link tree in the chat. I do know it's on one of the slides coming up. The Washington Health Trust covers all Washington residents and provides supplemental care to beneficiaries of Veterans Administration, the VA, and Indian Health Services. As far as pay and working conditions of those who work in healthcare, the Washington Health Trust does not directly impact pay or working conditions. What we're doing is handling one problem, the insurance companies, and then it's going to be up to unions to bargain the rest of those things that they need. Getting healthcare off the bargaining table will let unions focus their efforts on the needs of their members beyond healthcare coverage, and could do so without risk of losing healthcare benefits during a strike. So really making those, union organizing efforts a lot more strong. How do we pay for it? This is the number one question we get asked about the Washington Health Trust. We pay for it very similarly to how we pay for insurance now. There's an employer contribution, there's an employee contribution. However, it is not tied to employment. It's a payroll tax. So we've called it a healthcare assessment, but realistically, it's a payroll tax. Anywhere from 4.5% to 10.5%. So it would be transparent, it would be easy to manage and track, and it would be far cheaper than what most businesses are paying now. We're hearing on average, businesses are paying 18 to 22% of payroll. on healthcare. So this cuts that number in half at least. The hard part is that not all businesses are providing healthcare. So the Washington Health Trust legislation would require that employers pay in based on payroll, regardless of FTE status. So folks who are working at Home Depot and only getting 28 hours so that they can avoid covering benefits. There's no benefit to playing that scheduling game with the Washington Health Trust in place because that big box corporation would be required to pay regardless of how many hours that employee is working. And then everyone's covered by the trust. There's also a component of capital gains tax. We've kind of sandwiched it around the education capital gains tax because that's come into play in the last few years. All of this is being looked at. Another really good place for feedback from your union. So if your policy folks have not looked at this yet, if they have concerns about, the math here, we do want that feedback. We've been working with the Balance Our Tax Code Coalition as well as the EOI, the Economic Opportunity Institute, to get some feedback around if there's better ways to do this, especially considering the Medicaid cuts. The Washington Health Trust is going to be using the funds that are state-controlled healthcare dollars to start the trust. So Medicaid dollars and then PEB and SEB, basically deprivatizing those pieces of the healthcare system. And so the cuts to the Medicaid program do impact the solvency, the stability of the trust as it's brand new. So we are looking at those pieces right now. What if we don't? So I like this slide because it shows the cost of not changing the system we're in, right? So, oops, one too many. In the 1970s, we were paying about $2,000 per capita for total healthcare expenses on a national level. In 1993, Washington State was the closest to a universal system that we've ever been. At that time, we were paying nearly $5,000 per person. And then by 1995, all of the pieces of that Health Services Act were repealed. We were paying another $1,000. In 2000, when Healthcare for All Washington ran the Washington Health Securities Trust Initiative, we were paying nearly $8,000 per person. When they introduced it as a bill, we're up over 10 grand. In 2018, when Whole Washington picked up the same legislation and ran it as an initiative, we were up over 12 grand. And so you can see like these numbers just keep getting bigger and bigger and bigger. And that's really what's going to keep happening if we don't derail this train. So with that, we will take questions at the end. So please do save any questions that you have. We're going to watch this video from Pramila.
I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives. Thank you so much to Andre Stackhouse and the rest of the whole Washington team for inviting me to join you today. And thank you for your advocacy on healthcare access in our state. Your efforts to achieve high-quality, guaranteed, universal healthcare for every single person in America is absolutely critical to our movement. In Congress, I'm committed to the same goals, working to healthcare access and affordability throughout my district, our state, and this country. Just recently, I reintroduced my Medicare for All bill with Senator Sanders, which would expand Medicare to serve all Americans. This legislation is the only bill in Congress that outlines exactly how we would get to quality, comprehensive, affordable healthcare. It expands and improves Medicare to cover medical, mental, reproductive, dental, hearing, and vision care, as well as long-term care. In the richest country in the world, it is criminal that 85 million Americans are uninsured or underinsured, and that 1 in 3 Americans has medical debt totaling $220 billion, all while the top 5 private insurance companies have pocketed $370 billion in profits over the last decade. Medicare for All would finally put patients over profits and create a healthcare system where everyone is in and nobody is out, with healthcare when you need it, where you need it, from the day you're born to the day you die. It's not just good policy, by the way. It's also incredibly popular, and more than 70% of Americans support this legislation. At the same time that we are fighting forward for the healthcare system we need, we also have to fight back against the constant attacks from Trump, Musk, and Republicans on the healthcare system we currently have. Right now, they are working to slash Medicaid and Medicare for millions of Americans and to privatize Medicare through their Medicare Disadvantage scam, all so that they can fund a $7 trillion tax cut for the wealthiest billionaires and corporations. We cannot let that happen. So let's work together to stop those attacks and protect healthcare, even as we fight forward to pass a truly comprehensive universal healthcare system for all. I'm doing that right here in Congress, and I know that you'll be doing that work in our communities. Thank you for your commitment and dedication to ensuring truly universal comprehensive healthcare for all of us.
This is our exit task, but we're not done. So we've rearranged this a little bit so that we could get to the end of the presentation and turn off the recording and have a discussion. So I'm going to come back to this as part of discussion, if that's okay. We'll talk about commitments and next steps. Think about who you might talk to, who you might text or email or call that would be interested in learning more about either the labor table or the Washington Health Trust. How you can get your union involved in that policy review. Think about those kinds of things. We'll come back to that. So here is what you can do. You can attend our monthly labor table. We're on the fourth Tuesdays of every month at 5:30 p.m. You just have to email Richard Burton. He's the co-chair at AFT there. You could invite someone from this group to speak or table at a meeting or event in your area. We have our own events on our calendar if you're interested in getting involved that way. You could pass a resolution at your local or CLC. It could be in support of this movement. It could be committing resources to the movement. There's a really good sample resolution that WFC put together around, making a deeper commitment to the Healthcare as a Human Right Coalition, making sure there's folks available to do this work that we're doing. You can lobby your legislators. You can testify or make public comment at the Universal Healthcare Commission meetings or at a town hall that's, candidate season right now. So any of the town halls that they're hosting, asking questions about universal healthcare and what they plan to do to support the movement is a really great place to just takes a few minutes. You could use our social media toolkit, tell your story, invite others to share their stories, things like that there. Again, here's how you get on our invite for the meetings that we're hosting. And then here's that link tree I talked about earlier. So the one pager that aligns the Washington Health Trust with the Labor Campaign for Single Payers 10 points is in our link tree. So is a copy of the slides, if I remember correctly, as well as a variety of other tabling materials that we used in Wenatchee to just help support folks in understanding the full context of this work that we're doing. And then the slides do have some supplemental resources and you're free to use any of these pieces of the part of the presentation that you wish, including the link tree. I'm going to go ahead and stop recording now, and then we will have some discussion.